Welcome to Unsheltered Conversations, the podcast where we explore the human stories, partnerships, and solutions surrounding homelessness across our communities. I'm Scott Larson, CEO of HomeAid America. As summer approaches, many Americans look forward to longer days, vacations, and warmer weather. But in cities like Phoenix and Las Vegas, extreme heat can quickly become deadly, especially for people experiencing homelessness. For individuals living unsheltered, temperatures well above 100 degrees are not just uncomfortable like that might be for you and I. They create serious medical emergencies involving dehydration, heat exhaustion, heat stroke, and in some certain circumstances, death. So today's conversation is about preparation, compassion, partnership, and action. And joining me today are two leaders deeply engaged in this work. My colleague, Cindy Kinville, Executive Director of HomeAid Phoenix, and A.B. Schwamenlunder, the CEO of Keys to Change, one of America's leading organizations serving individuals experiencing homelessness and operating key intake and coordinated response efforts throughout the region of the Phoenix metro area. Together, we're going to discuss what extreme heat means on the front lines of homelessness, hear about how communities can prepare and respond, and what all of us, including the building industry, can do to help save lives. So Cindy and Amy, welcome to Unsheltered Conversations.
Thank you. Happy to be here.
Yeah, thanks for the opportunity.
So Amy, let's start with you. I know that your organization, Keys to Change, has been very involved, and we'll touch on this in a little bit. But for listeners outside of Arizona, help us understand what the summer heat in Phoenix actually means for someone who's living outside on the streets.
What the summer heat here means is like danger, right? I grew up in Wisconsin, which is hot and humid in the summer. I've been here in Arizona now over 20 years, and takes a while to acclimate to it. And if you have an air-conditioned car and you work in an air-conditioned place, it's easy to go in and out and not necessarily feel heat for very long. If you are homeless and if you're unsheltered, you're spending most of your time outdoors in a city that has very little when it comes to tree cover, bus stop, shade areas that are very small. They're not built for people to be able to sit on them or lay down, fall asleep on them for very long. And the high today here is supposed to be 107 degrees. It doesn't take long with no clouds in the sky for every surface to feel hotter than 107 degrees. And Phoenix itself has become a bit of a concrete island. And this urban heat effect that people smarter than me in that science study it and look at it and do heat maps and show how dramatic the increased temperature is. And so for people who are outside, if they sit down on the concrete, they sit down on a sidewalk, they lean up against a metal fence, their skin can be burned. You start to sweat initially, but if your heat exhaustion, your heat illness starts to turn into heat stroke, your body actually stops sweating. And if you've experienced any of that a little bit, maybe starting to get lightheaded or dizzy if you get hot, you sit down, you cool down, and maybe you're okay. But if you never have a chance to cool down, you're not okay. And you can start to feel disoriented. You can start to exhibit what people might label as very odd behavior. It happens quick. And I think when I think again of Wisconsin and winter and snow and ice, you can see that. You don't see what heat is doing to the environment.
Yeah, you bring up a couple of interesting points. One, today, when we're recording, it's 107, but it can get well above 120 in Phoenix, correct?
Absolutely. Just 2 summers ago, we had the longest streak ever of temperatures. I believe it was over 115. And that means at night, it's staying above 90 degrees.
Yeah, and then you bring up the other factor that our community will know very well, the built environment, and whether or not it's concrete or asphalt, those retain heat and bring the temperature even up higher.
Yeah,
And,
exactly.
you and I will go in and out your car and you go through the air conditioned portals to go into buildings and different things
hmm
like that. And
hmm
we're in and out of it. But you're right, those that are on the streets are extremely vulnerable, particularly to, you know, unintended burns and things that you're bringing up some very important points that I don't
Mhm.
think people really understand. So what's the length of time? I mean, what's the window that is the most vulnerable months? When do you see
Where
the height of these issues taking place?
usually it starts late June and through July. This March, we had temperatures over 80 degrees, and we weren't prepared for that in the sense of wanting to have more water to hand out to the people we serve, to have a setup where we have portable evaporative coolers, which may mean nothing to some people
Yeah.
as to what a portable evaporative cooler can do. For me, I've been here almost 8 years, and when we thought of summer and heat relief, we thought of maybe May through September. And what we find ourselves facing is now it feels like April we need to start preparing. And it's been certainly through October and sometimes into early November where it's still extreme heat. And so that length of time seems to keep expanding.
Yeah. So you're clearly seeing it getting overall worse and
Yes,
length of time and then temperatures rising. Yeah.
exactly.
That
Hmm.
and we're seeing in communities across the country, in here in Southern California, we're seeing fire season is year round. And so we have to prepare for
Right,
those types of things. And so,
right.
it's not just a few months, it's something that you're having to prepare for probably at least half the year in
Exactly.
in that regard.
Exactly.
So Cindy, let's pull you in to this as well from HomeAid's perspective. Why is this issue important? I mean, you've lived in Phoenix for a long time. It's been your community.
Yeah.
But why do you see this being important for our community and the broader community to understand?
Well, I think homelessness is often just overlooked. We're out on our streets, we drive by people, they're sitting under a tree, they're trying to stay cool, and we really just pass it by. And I feel why it's so important is to really understand the impacts that this heat has, and that as a community, we can step up and help support that. If we stopped and just handed somebody a bottle of water, it could mean a matter of whether they don't dehydrate or they
Yeah.
do. For me, that's the really the impact is really understanding for the broader community that they're people, they're human beings. They didn't wake up one morning and decide they want to live on the streets. There are so many circumstances that created that environment for them, and we just need to step up to the plate and see what we can do to support them.
What have you learned about as you've brought this issue to the homemade community about partnerships and then outreach efforts like Keys to Change? Has it been enlightening for the building industry and people that you're working with on this topic?
It's really been very enlightening. I think, the biggest impact is really being able to go to different facilities like Keys to Change and see it firsthand and understand the number of individuals that are seeking services and the compassion and dedication of the teams out there trying to make it happen, whether it's the volunteer that we get introduced to that's giving of their time or the teams at the different shelters or places. These are really, really caring people. And it's hard to visualize it until you actually walk the walk. And that's really been one of the things from the outreach, even for me personally. Again, I've been that driver driving, seeing the person in the corner, begging for that dollar, and you just drive by. But when you go and you talk to people and you hear their stories and you understand, gosh, this could be me. I could be one crisis away from being at Keys to Change looking for support. So it's just been very enlightening.
So, Cindy, also you've had public health in your background as far as your employment. How do you see this intersect with issues in public health? It may appear to be obvious to some, but maybe others aren't really realizing that connection during this extreme weather.
For sure. I mean, homelessness and public health are deeply connected. I mean, especially during the extreme weather, but really always, right? I mean, it's always connected. When people are experiencing homelessness, they lack safe shelter, they lack clean water, they lack the medical care, and they lack the climate controlled environments. As Amy was talking about, you and I and others in Phoenix, we can walk in and out of that climate control and keep our body regulated. The homeless don't have that opportunity. And dehydration can happen really quickly. I mean, depending on your age, your health, your exposure, it can happen in as quickly as 30 minutes for someone to start dehydrating. So, what's important to recognize, I think, is addressing homelessness. is preventive healthcare. I mean, they go together. When we create those safe and stable environments and sustainable housing, and we work and support our nonprofits, we reduce the health emergencies and we improve stability and we strengthen our overall resilience in our community.
Yeah, so this is clearly not just a housing issue. It's a life safety issue in your community. And it's not just Phoenix. I mean, it's Las Vegas, it's, Reno, and even where I live in the Inland Empire in Southern California, it can hit well above 120 degrees in a very desert-like environment. And one might think that a car might be safety and refuge,
Mhm.
but who's gotten in their car at the
Yeah.
at the end of the day and the temperatures that are in there?
Yeah.
That is not a safe
Yeah.
refuge either.
No, and in
Mm,
Phoenix, you have to have
mm-mm.
your oven
No.
gloves to kind of
Yeah.
touch the steering wheel.
Yeah,
So, yes.
exactly.
Yeah.
So Amy, let's dive into what Keys for Change does. How do they play in this regional response system and what role that Keys to Change has?
Sure. So, Keys to Change, we operate a signature program called Key Campus. It was formerly called the Human Services Campus. It opened in November of 2005 as a way to bring together an array of service providers that help adults experiencing homelessness. In our community, before that, there was a healthcare for homeless clinic and an emergency shelter and St. Vincent de Paul dining room with meals, but they weren't necessarily walkable either. And people in the community had this idea of co-locating services and really working towards collaboration to ensure as many services as possible are co-located here at one place. So we have a 13-acre campus. It has 8 buildings. We have about 10 different organizations that operate programs in those spaces, everything from healthcare and dental care, emergency shelter, our state Department of Economic Security, the county homeless court, 3 meals a day. And we all work together to serve people who show up here. They're experiencing homelessness. As you know, I think everyone has said so far, no one wants to be homeless. And so how do we focus on helping people with their immediate needs? So if it is a health issue, how do we help them stabilize in health and all work together on a housing plan to help them exit out of homelessness? And last year we served around 20,000 unique individuals.
My,
My is right, right
yeah,
there. Uh, so we have a really unique model. We're the largest place for homeless people to come for services in Arizona. You know the HUD process, the continuum of care, and,
yeah.
and a lot of what that means. And we have a HUD contract to be the lead for coordinated entry for single adults or adults without dependent children. And we work closely with the family system. And being that lead means that we do intake and assessment, but it also means that we're in a position to know where all the other access points are across Maricopa County, which there's about 40 for adults where they can have the same intake and assessment. It also means that we can coordinate and share resources. So it could be dollars to help with family reunification that we can spread through this network. So people who are homeless in Maricopa County don't all have to come here to our location in downtown Phoenix. If you're homeless in Mesa or Scottsdale, you don't have to come here to get connected to that intake. We can work with other organizations, connect to the intake, work on housing, or like I said, a family reunification. When it comes to, heat and water, we're a 24/7, 365 location. We have a cooling center area where people can come in for that respite. And then we're connected to the network that really Maricopa County Public Health manages, the heat relief network for the county. Just by the fact that we serve the most people, we're seen as a hub and a go-to for how to start to get anyone who's homeless connected to services.
And that's so critically important because one, this is a complex issue. Secondly, it's a complex system. And if you're on the streets, how do you navigate it? So I'm grateful for your work. I'm grateful
Thank
that
you.
there's the vision to have an entity that sees everything because there's going to be siloed organizations for different
Hmm.
reasons, but
Yeah.
someone has to see the whole system. And
Mm.
someone who's on the street or that has lost their housing or is in crisis isn't going to be able to figure it out without an organization like yours. So
Thank
when you
you.
look at these hydration efforts, you mentioned the cooling centers. What other things are you doing? Do you have outreach teams? Do you have emergency coordination? What's the mechanics behind that? Is April's coming, May, and then you're heading into the summer. What do you gear up for in your system, in your programs?
We do have a small yet mighty street outreach team. Would always like to have more outreach staff because Maricopa County is huge. And so one thing that we have to do rather than really looking countywide and regionally when it gets into summer and heat is to focus our outreach team closest to our campus. And that means engaging people in a conversation. It can be starting with offering the bottle of water and inviting people to come on the campus if people don't know, like you said, how to navigate or what services are here. The outreach staff can assist with doing that. We partner closely with City of Phoenix that has an Office of Homeless Solutions and an outreach team as well. Several of the organizations on our campus also do outreach. And so we really amp up the coordination. Again, we have to be careful that our employees aren't outside for
Yes.
long periods of time in the summer either. And so it's also early in the spring, reminding everyone what the policy is on, if you have a job outside, you have to take regular breaks. You have to go indoors. You have to cool yourself off if you're going to serve other people. And that ongoing education for employees, volunteers, we have groups that will come onto the campus and do an easy way of looking at it is a welfare check. So
Right.
we have a plaza outside. We allow people to be outside. There's shaded areas. Still checking on folks, though, to make sure that they're maybe recognizing maybe they have been sweating profusely, but then all of a sudden that stops and they may not know that that's a sign that their heat effects are increasing and they really need to go inside and cool down. So having volunteers help with those efforts, doing that outreach to find volunteer groups that are interested in doing that. We start to put our call out for heat relief items. We're always advocating to all levels of government to say it's not a new issue. It's always been hot in Arizona. And as it seems climate changes and that summer's lengthening, the heat's changing, we really need the support and the public and the private sector to help us be more ready for heat and come up ideally with more indoor options so that people have a safe place to be.
Yeah, you mentioned government and then obviously different businesses that could get involved in faith communities, et cetera. But I recently saw on your website your Thirst Aid initiative. Can you
Yeah.
explain kind of what that is and
Sure.
how people get involved with that and why does that matter?
It's a longstanding effort here on the campus. One of the partners that was here originally, St. Joseph the Worker, came up with the name Thirst Aid. And we come together again as all the campus providers to ask community for support. We distribute over 120,000 bottles of water per month in the
Wow, per
summer.
month.
Per
That's
month.
amazing. Yeah.
120,000 bottles. And that, again, we started looking at that May through September, and now we know we really need that probably April through October, if not longer. And so Thirst Aid, during the pandemic, we changed up Thirst Aid to create a drop-off spot. I think other communities and volunteer groups were finding ways to invite people to just simply drive up, drop off your donation, and then drive away so people weren't spreading COVID. And we've continued to do that the first Saturday of each month through the summer. We have a street that leads up to the campus. We staff it with a partner organization, and people will deliver sometimes an entire pallet of bottled water. It could be cases of bottled water. It can be money so that we can go purchase water. It's other items like lip balm, sunscreen, baseball caps, bandanas, the cooling towels. And so we promote Thirst Aid, yes, on our website, media advisories, press releases. There are regular groups who know now that we do this. And Maricopa County has done competitions between staff departments in the past to say who can raise the most water to take over to Key Campus. And we're really dependent on community supporting us that way. We can't do it by ourselves.
So, Cindy, how has HomeAid Phoenix, speaking of aid, that's incorporated into our name, HomeAid. Cindy, how has HomeAid Phoenix participated alongside Keys to Change with these types of efforts?
Well, last year we did a very large summer essential drive, and we were able to raise enough money to buy 2 semi-truckloads of water.
2 semi-truckloads.
Yeah.
That is a lot of water.
That's a lot of
Yes.
water. What we recognized as HomeAid Phoenix is that raising the dollars and sharing those funds with Keys to Change was really more advantageous because they had more buying power than we could as buying one case of water at a time and trying to deliver it. So that's the route that we took. I was surprised, as Amy just said, 120,000 bottles a month. So 2 truckloads is probably about 2 weeks worth of water. So
Might be
it
2
makes
months.
Yeah.
Yes, it is.
so we're just very excited to do that. And we also brought in a lot of the essential items she talked about, the lip balm and bandanas and cooling towels. And we are actually going to be kicking that off again here in the Phoenix area around July 1st to bring all that in again and
Yeah.
support Keys to
Well,
Change.
well, clearly, Cindy, you and I both know that our industry, the construction industry, is very well aware of these issues when they're having to work out in the heat. Yeah, they have to arrive early because construction doesn't change during the summer months. I mean, it might be limited, but have you seen your partners really rally around it? And who else needs to be involved from your perspective in your community or broader construction and home building industry?
I think, the home building industry really has embraced it. And to your point, Scott, they understand. I mean, they deal with it with their own employees and trying to figure out how to schedule them. So, the days start early. Now they're out at 5:30, 6 o'clock in the morning, and they're leaving the job sites, noon. Noon is kind of late because it's already 95 degrees in the middle of the morning. So,
Right.
but we're also incorporating a lot of our trade partners are really stepping up to the plate and helping out in addition to the builders and just the community at large, just getting the word out. There are many community groups out there that just don't even know how they can help. So the more of us that can spread the word on what they can do and whether they give up their time or their talents or their resources, it all makes an impact. So that's really what I try to do here at HomeAid Phoenix is educate and invite people in to support our on-house neighbors.
Yeah. So, Cindy and Amy, there's going to be things that you're already needing or working on. Obviously, the water, you've mentioned baseball caps and lip balm, sunscreen, et cetera. But are there hygiene kits that are needed, or do you need portable shade structures? Is that getting to be too much? Or where
Uh-huh.
should the focus be when
Yeah.
people are wanting to participate in either directly with Keys to Change or supporting the efforts, Cindy, that you're doing with Homemade Phoenix?
I mean, I think one of the things HomeAid Phoenix also has helped with at the Keys to Change campus is we put in a dog park. Sometimes we
Yep.
Wow.
forget about the little
Yep.
four-legged friends that our unhoused neighbors are, they're companions. So putting in shade and putting in some turf and watering opportunities for the animals was, I think, very important. That's why I say sometimes it's thinking outside of the box. Like what else can we do to support not only the individual, but the nonprofit organizations that are doing this hard work every day? And I believe it made an impact. And
Definitely.
sometimes it's just a small little gift that can make a life changing moment for individuals experiencing homelessness.
I'm
Eh,
glad
Go ahead, Amy.
I'm glad you brought up the animal park because yes, we also collect booties for the paws of dogs because we talked about the effect of heat on the people, and many people are homeless and have dogs. They have cats too, but we don't see the cats running out and about, fortunately, on the sidewalks. The dogs know we need to protect their paws because their paws will also burn. And so there's, an opportunity to collect and donate those items. From a shade structure perspective, we've added shade on the 13-acre campus. We have other areas that would benefit from whether portable or some different type of installation, especially over sidewalks where sometimes people have to line up. They're waiting to go into the dining room for a meal. And so they are lining up outside. And there are areas that aren't shaded. So that would be a wonderful addition. At times, we've had people collect umbrellas for those who are homeless. If you don't live in Arizona, you may wonder why are people walking around downtown with an umbrella? There's no rain, but the umbrella does
It
protect
protects
you
you.
from some of
Yes.
the sun. And I know people who have had skin cancer and they're all about walking with their umbrella. So sometimes it's, having umbrellas to be able to hand out to folks if they're waiting at bus stops and they're walking long distances between bus stops and light rail stops, having an umbrella, if not the baseball
Yeah,
cap
you don't
to.
think about that. If you have one in your car, you can just hand that to
Hmm.
someone who's walking basically
Definitely.
unprotected.
Definitely.
So I
Yeah, we
know that.
definitely
Oh, go
include
ahead,
that in
Cindy.
our essentials drive is umbrellas. And to Amy's point, I had to educate the members of HomeAid to understand, the importance of the umbrella, and it makes sense.
Yeah. So do either of you have stories of how someone's life has been impacted, or maybe someone who all of a sudden really became aware, Cindy, in the building industry? Are there any personal stories that either of you want to share?
I think in the building industry, kind of going back to what I talked about a little bit earlier, is it's been a lot of aha moments for people that have finally walked the walk. And I love the enthusiasm and passion that has come from that and their creative ideas. So it's an awareness that wasn't there before. And you can see the sparkle in their eye of like, oh my gosh, what can I do to help? And that's very exciting because you have to have people understand the need in order before they're really to take on the challenge. And I feel like that's what's been monumental for me is watching it transform from people kind of shrugging off the homeless issue to going, oh my gosh, this is something that we need to tackle and we need to support these young adults, old adults, these children that are facing homelessness. And how do I make an impact? So I have loved watching people kind of go from, why is this issue important to me, to I'm all in. What can I
Yeah.
do?
And Cindy,
Mhm.
we see that all the time because when we tap into that passion, it's unbelievable and it's almost magical in many aspects to be able to see
Yeah.
that light go on. Amy,
Yeah,
anything that you
exactly.
want to share?
I have a lot of stories. I do think the volunteerism and having people connect to the work, whether if that's for an hour or 4 hours. So when Cindy brings a group of people for them to meet a few individuals who are experiencing homelessness, that's where I've seen the realization happen. I've heard people who have volunteered tell me stories about, oh, I volunteered and I talked to this person and they reminded me of my brother or
Mm,
my mother, or they start to realize themselves or someone in their family was either homeless or on the brink of homelessness. And I think that connecting people and humanity is where people might change their minds and see homelessness differently. And then they maybe find compassion and passion and they want to do something more to help take care of those who don't have a home. I have maybe never ending client stories. And
oh, yeah.
which I think it is important because it can be really easy to talk about all the need and the demand and how many people are homeless and they might die in the heat. And at the same time, our team and our partners, we're helping people move out of homelessness every single day. And that's also not necessarily as visible. Unsheltered homelessness is visible. We see across the county more tents in places where people were never camping before. And that part is simple to show homelessness. To show the success is a little more challenging because we're maybe moving one person into an apartment today. They don't have a moving truck full of furniture. They maybe have one backpack and a duffel bag. It's not a photo opportunity. And a lot of people don't want to tell their story about being homeless and moving into housing. But those successes are happening every single day. And it becomes a more urgent conversation for our team as the heat really impacts people and we see the people outside. How can we connect them faster? We've extended some of our hours about a week ago, and we're looking to see if we can extend our hours even more for people to simply be on the campus where they can access restrooms, where they can be in a more safe, shaded area. And it's about continuing to amplify and create urgency around we can create positive outcomes. We need the resource and the attention to be as high as the need is.
Right. Well, and then both of you touched on, the human connection and the dignity, and that's really part and parcel of who we are, why each of us as individuals, the three of us, and people that get engaged with this. But Amy, how do we support your frontline workers and how do you keep them motivated? Because they're probably struggling as well in different aspects in the heat. And what can we do, even if it's
Mm.
just mentally is supporting you? But how do you
Yeah.
keep your team motivated?
Channel positive vibes.
Exactly.
Um, that's a constant leadership conversation because we know we're not necessarily paying everyone what they deserve to make. We have to raise every single dollar that it takes to operate the organization. We've challenged ourselves year over year to see if we can, raise hourly rates, if we can do anything differently with benefits. A lot of our frontline staff have a lived experience of homelessness, substance use and treatment, domestic violence, incarceration, like name the things that might lead someone to be homeless. 75% or so of our frontline staff have one or more of those experiences, which for me is really really good and it's a strength because I feel like people who have that lived experience do a better job of engaging with our clients and teaching them and showing them the way. At the same time, it can be a very traumatizing, retriggering environment. And that's why as a leadership team, we talk about it essentially every week. What can we be doing to further support our employees? Can we change out a benefit? One of my staff recently went on a visit through a fellowship and came back saying, I met people that their organization went to a 32-hour work week. And I was like, okay.
Yeah.
Yeah, it took them 3 years apparently to make that transition. But there's big ideas like that. And then I think over the last year, it feels more, I don't have the data to prove it, feels like more groups have reached out and offered us tickets to the symphony, the Arizona Diamondbacks, to a baseball game. And again, it might not seem like a lot when we have, 30 tickets to offer to employees that they've never been to the symphony or the ballet, and they can put their name in and be drawn and maybe take one of their kids to have that experience. That little thing boosts them up. And it's a perk that, they're working like almost in an emergency room setting every single day. And so I'm open to ideas too, if anyone, hears and watches this and has an idea about how to further support our staff. I really appreciate you asking the question.
Yeah. And that's critically important because in our normal world, we think of, going to a ball game or going to a play, but that is a tremendous perk. I'm
Mhm.
glad we had that part of the conversation. And
Yeah.
do you see, Amy, you talked about the continuum of care and the role that your organization had. Are there some key system changes that are needed, or what do you see in the immediate future that is either impacting you or that needs to change?
Yeah, it can be really challenging to think about what might happen right now at the federal level and with HUD. And what I remind myself of is focusing to the goal, which is really reducing homelessness over time and making those systems connections. And I think what we see and feel is that I think most communities would benefit from a greater connection between prevention of homelessness to the episodes of homelessness and then to housing. And prevention means helping people stay stably housed. Our community has an inflow of about 2 households for every one household that becomes homeless that we can help them be rehoused. And so that means the demand on homeless services continues to increase. So how do we connect like community action program efforts where there's rent and utility assistance? How do we look at that part of for me, it's homeless prevention. How do we look at connecting prevention to the interventions of services? And of course, you all know we need more housing options and we need greater affordability in housing so that we can help people who do lose their home be more rapidly rehoused. And so I think in those three big buckets, prevention, intervention, and housing. And I see a lot of opportunity for systems to be better connected and reduce homelessness.
Yeah. And that's great. And I'm glad that you see it that way. And hopefully the political leaders in your community and others see it that way as well. It's a continual education process. This might
Yes,
be
it
a loaded
is.
question, but for you personally, what gives you hope in this? I mean, you're on the front lines every day and you've been doing this work for 8 years now there at Keys for Change, but what gives you hope?
hmm well, exciting thing we've been working on over the last year, launched in January. We're partnered up with 3 other large shelter organizations, nonprofits that do shelter and other things: Central Arizona Shelter Services and New Leaf and New Mom, New Day Centers. And we formed the Arizona Shelter Network. Again, thinking differently about how can we as service providers change the story, change the frame and how we talk about homelessness. And we're really focused on, again, as the direct service providers, understanding what works in emergency shelter, understanding what's really needed in shelter capacity. We have a long-term vision of adding shelter beds in
Yeah.
Maricopa County so that anyone who was homeless could access a shelter bed, which they can't do today. Our short-term goal, given all of the uncertainty around funding, is that we retain the shelter capacity we have today. And that gives me hope because I was at the local United Way for 13 years before coming here and making attempts at collective impact and how do we bring, again, public and private sector together to work differently. And then being here as a direct service provider and realizing the service providers haven't organized themselves and become truly coordinated. And so we've done that, and it gives me hope because we're working differently together. We built trust with one another. We're sharing data. we're having real conversations about program criteria and support for case managers. And I'm optimistic that by service providers leading the way, we'll be able to make some of that longer term change.
No, that's great because it's more grassroots and it's come from within. That's great.
Yeah. Yeah.
So, Cindy, on your end, in this conversation or what you're seeing there in Phoenix, what do our other affiliates or communities within HomeAid need to learn or the opportunity to learn from what you're doing there in Phoenix?
I think, really putting a direct effort into trying to do those summer essential drives, whether that's for water or all of the other things we've talked about, the lip balm and the bandanas, and making a very concentrated effort to do that and to get it back out to the nonprofit partners. And just recognizing that sometimes value to the nonprofit is more the financial piece of it, says they have more buying power than we do as a nonprofit standalone organization. And so for me, that was a big lesson. Understanding when I talked to Keys to Change and what they can buy water for and what we could buy water
Yeah.
for was night and day. And
Yeah.
they were able to double or probably even triple the impact because we turned over a check opposed to trying to take them water. So
Right.
I think that was a big learning lesson for me because I had never thought of it in that regard that, oh gosh, yeah, if you buy it by the truckload, it's probably going to be cheaper. So,
Exactly.
Yeah.
Exactly.
yeah.
And I'm just really pleased with how the building industry has responded ever since HomeAid Phoenix got established and the work that you're doing. And so I'm glad that you're providing these opportunities for them and the unique role that they can play. So as we come to a close here, I'm going to do some just little rapid fire questions. So Cindy, what's one word for you that describes HomeAid Phoenix?
Authentic.
Very, very true. I see that day in, day out. What's been the most inspiring moment that you've experienced in the years that you've been with HomeAid?
Gosh, unrelated a little bit to the whole heat crisis, but every year we do a very large volunteer event, Paint-a-thon, and 180 people come to one location and transform a community. And to see the before and after and to watch these people paint homes and fencing and put addresses, it's so inspiring. And it's like in one day, we can facelift an entire community and really show those members of that community that there are people that care and respect them and really want them to live in a dignified, a respectful community. So yeah, that's been so inspiring for me.
No, that's great. And I've seen that as well. And it's beautiful, the work that you've done. So this has been your community for a long time. But what does community mean to you?
It really kind of means, bringing people together with a sense of responsibility and a belonging, getting people the opportunity to be seen and heard and listened to, because I think a lot of times in community, we forget to listen to what our community members are asking of us. And I think, in the work that we're doing at HomeAid Phoenix, it's really been an opportunity to transform communities through the resources and the talents of so many of our partners. And it really can help us rebuild and bring in hope.
Absolutely. So, Amy, what about you? What's one thing that every person needs to understand about homelessness?
No one wants to be homeless. No one really chooses to be homeless. And it becomes incumbent on those of us who have housing to help connect those who have lost their home to be supported and find new housing.
Absolutely. And we've already talked about hope for you, but is there other things that keep you going during these difficult times? I mean, you're heading into summer, there's funding issues, but what keeps you going during difficult seasons?
I have to remind myself and, I make myself go out into the program spaces and connect to individuals, our clients and our staff, because it's amazing to me how resilient people are. And so if something has frustrated me, I can walk across the street, start saying hi to people. And some of our clients, they just need that hello and how are you doing today? And their smile reminds me like, this is why we're here. We're serving people every day. We're helping people end their homelessness every day. And our employees are doing the same thing. And so really they provide me the motivation, the inspiration, and that daily reminder of why we do this work and then focus to the goal.
Yeah. Well, as we wrap up, I appreciate both of you greatly. And I know in our household, we need to all drink water. You're talking to myself and my spouse and my daughter. And so as we drink water, I hope that that translates into people understanding the need for what you're both are doing for those that don't have direct access. Any closing comments from either one of you before we wrap up today?
Yeah, I'd just like to say, as I mentioned earlier, Homemade Phoenix will be doing their summer essential drive again. We're actually going to do something a little different this year. We're having a pickleball fundraiser, and
Oh,
every
fun.
dollar raised will help support the purchasing of water. So look for that information on homeaidphoenix.org. It'll be under our events, and sign up. And if you're competitive and like to play pickleball, we'd love to have you.
Well, that's wonderful. How fun. Amy, anything from you?
I want to thank both of you, and I want to thank Cindy. She and I have known each other for a while in different organizations. And when she went over to HomeAid Phoenix, she reached out to me, and she always thinks of us and she remembers us, and she'll ask. She walks the talk she just gave about asking what we need and not assuming or presuming. And really has come through for us on the regular. And so I really appreciate Cindy and her local work here.
Yeah, we do too on our end. So as we wrap up for our listeners, extreme heat, you may think it's only seasonal, but the vulnerability of people that are living on the streets that are experiencing homelessness is constant all year round. So what both your organizations demonstrate is that saving lives requires more than just emergency response. It requires partnerships like the two of you have talked about. It requires compassion. It requires preparedness and long-term solutions. It's not just today, but what are we doing as a whole with the systems in the buildings? So at HomeAid, we often talk about building new lives, but before someone's lives can be rebuilt, they need to first have stability. They need to have safety and the assurance that the community, as we've talked about in this podcast, sees them and can come about around them. So I hope today's conversation for our listeners encourages you not only to be better, but to understand this crisis and to also seek how you can become part of the solutions in your own community, whether or not it's in Phoenix or anywhere across the country that people are listening to this. So thank you for joining us today. This is Unsheltered Conversations, and I'm Scott Larson.